again today with another video that concerns osteology introduction as always, and this time we will finish the second part of the skull. And before we start, I want you to subscribe in this channel and hit the like button. Now let's start. In the previous video we said that we have 8 cranial bones, starting with 1 frontal, 2 parietal, 2 temporal bones, 1 occipital, 1 sphenoid, and 1 ethmoidal bone. And in this video we will discuss the 14 facial bones, starting with the mandible. The mandible or the lower jaw is the strongest bone of the skull because of the attachment of many muscles. For example, muscles of mastication, temporal muscle. It is what forms the temporomandibular joint, the only movable joint, and by the way, it is the only movable bone of the skull. It is composed of 3 parts. At the middle we see here the body of the mandible, bordered inferiorly by the mandibular tubercle. Laterally we have the ramus of the mandible, bordered inferiorly by the angle of the mandible, superiorly by the mandibular foramen or notch, and also we have the internal portion of the mandible. Okay, so let's talk a little bit about the ramus. The ramus is composed of 2 processes, superiorly 2 processes. The anterior called the coronoid process, where the temporal muscle attached, and posterior is the mandibular or condylar process, and this process is what joins with the temporal bone to form the temporomandibular joint. We talked the last time that the temporal bone is also composed of the mandibular fossae and the articular tubercle, and these 2 structures join and attach with the mandible at the condylar process to form the temporomandibular joint, and this joint has the major role in mastication, eating, speaking like I do now. Okay, so now let's talk a little bit about some features of the mandible. We have the alveolar processes here where the teeth insert. Underneath this process is the montal foramen of the mandible. The montal foramen is so called because some people said that when we think, we put our 2 fingers on this mandible. Okay, and this is why we call it montal جاية من thinking. Okay, like we see here in the picture. Okay, this woman is thinking and putting her 2 fingers on the montal foramen. Okay, other note is says that the mandible we have only 1. Okay, but it wasn't like that. In Arabic المانديبل كان عنده كان 2 os ما كانش ان سول ولا فيزيون صرات during the first year. Okay, we كان عندنا 2 right and left bones, and those 2 bones fuse together during the first year to form a single bone. Okay, we finished with the mandible. Now let's move to the maxilla. The maxilla we have 2 right and left. Some features of the maxilla are the infraorbital foramen. The maxilla is the largest bone of the skull. Okay, the cranium. It has also the palatal process, and the palatal process is what forms much of the hard palate. Okay, if we see here, this is the maxilla, and here we see here the palatal bone. Superior to this palatal bone in green, this is the hard palate formed by the palatal process of the maxilla. Okay, in green is the palatal process, and this palatal process forms the hard palate, and the hard palate is the الحنك الأعلى. We have 2. We have a hard palate and we have soft palate. Soft palate is not composed of bones. Okay, maxilla has also, like you see here, this alveolar processes, and the maxilla forms the upper jaw, الفك العلوي. Okay, so let's return. It the medial floor of the orbit. Like we see here, this is the orbit, and the medial floor is formed by the maxilla, and it forms also the lateral base of the nose. This is the nose, and its lateral base formed by the maxilla. So let's finish other facial bones. Also, we have two palatine bones. We saw them here. Two palatine bones here, okay, forms the hard palate with the maxilla, and then we have two lacrimal bones. Lacrimal bone is the lacrimal bone is the smallest bone of the cranium, and it's where the tears collect. Okay, when الدموع يتجمعوا في lacrimal bone. Also we have the lacrimal gland. The lacrimal gland الغدة الدمعية هي اللي produce لنا الدموع located in the frontal bone. هنا تكون the lacrimal gland here. Okay, and those tears collect on the lacrimal bone here. This is the lacrimal bone. So we have two. Also we have two zygomatic bones. When we say zygomatic, we must remember the cheek, الخدين. Okay, when we touch our cheeks, we feel the zygomatic bone. Also okay, let's see it. This is the zygomatic bone. Okay, so we have two zygomatic. Also we have two nasal bones. The nasal bones form the bridge of the nose, where when we put our glasses, we can put them on this part here. This part is formed by the nasal bones, two nasal bones, the right and left nasal bones. So also we have the vomer. We said the last time that the nasal septum is formed, the anterior two-thirds formed by the ethmoid bone perpendicular plate, and the posterior one-third is formed by the vomer. This is the vomer here. This is the vomer, and this is the perpendicular plate of the ethmoid. This is the vomer, like you can see it here. Okay, so we finished with the facial bones. Now let's discuss a little bit the auditory bones. The auditory bones are the smallest bone of all the body. I know you heard about it. سمعتوا بيهم les trois os les plus petits تاع le corps are the bones of the middle ear, l'oreille moyenne, and they are malleus and stapes. This is the malleus and stapes. Okay, they are the first bones to fully ossify and are mature at the time of birth, where they don't grow afterwards. Means that those bones هما الأولى اللي تصير لهم l'ossification وبعدها ما تصير لهم aucune maturation، يقعدوا هكا قاع لافي. Okay, they transmit vibration of the tympanic membrane to the oval window. Okay, let's see. This is the tympanic membrane, the end of the external ear, and this is the oval window, the beginning of the internal ear. And the vibration, les vibrations sonores يفوتوا من la membrane tympanique حتى لهذا la fenêtre ovale by those auditory bones. Okay, so now let's see the orbit. The orbit is where the eyeballs are located. Okay, so they are bordered superiorly by the frontal bone, laterally by the zygomatic bone. Also the sphenoid bone, when we see the orbit, we firstly see the greater wings of the sphenoid bone. Okay, and medially by the maxilla, palatine bone, lacrimal bone, and ethmoid bone. Okay, this is the orbit. The nasal septum, we discussed it. We said that it's formed by the perpendicular plate of the ethmoid and also by the vomer. Also, the nasal septum is formed by the conchae. Okay, we have the middle nasal conchae and we have the inferior nasal conchae. راح نخلي هذا لي فيشي وهذا لي زيماج لي زارتيكل اللي خدمت بيهم هذا لا فيديو غنخليهم في الديسكريبسيون. ما تنساوش تشوفوا لا ديسكريبسيون باش تفهموا اكثر، وكش واحد ما فهمش حاجه ولا بغى يتعمق في حاجه يشوف في الديسكريبسيون سيب لي سورس اللي خدمت بيهم. اوكي. And lastly, let's talk a little bit about paranasal sinuses. The paranasal sinuses are air-filled cavities lined by nasal mucosa. هما جايين دي cavité remplis d'air فيهم air cells and they produce mucus. Okay. الرول تاعهم their role they serve to reduce bone mass and lighten the skull. ينقصوا لنا لا ماس تاع لي زوز تاع لو crâne. Also add resonance to the voice, humidification and immune defense. اوكي. هاد لي سينوس بارانازو يديروا لنا يبروديسوا لنا الميوكوس. هذا الميوكوس ينقص لنا لا ماس تاع لي زوز، يدير لنا لوميديفيكاسيون من لاغ يدخل باغ لو ني، يتصرى له هوميديفيكاسيون بهذا الميوكوس تاع لي سينوس. Also when bacteria enters they kill this mucus kill all the bacteria and this explain the immune defense. This part here talks about the disease swelling of the mucosa. Okay, when here what they say that when we are sick, okay, it means تصرى لا غريب ولا يصرى ان بروبليم في هاد لي سينوس، تصرى برودكسيون اكسيسيف تاع هذا الميوكوس، وهاد لا برودكسيون اكسيسيف تبلع عنا دينا بلوكاج. لا بروميير دي شوز تبلع عنا الباثواي بين لي سينوس ولا كافيتي نازال، وهذا الشيء يخلي لا فوا تتبدل. اوكي. also قال لك هذا البلوكاج يعمر لنا هذه السينوس، يتعمروا بهذا الميوكوس، وكي تعمروا تولي سونساسيون تري دولوغيز، بها نحسوا بلا دولور في هذيك البلاصه. اوكي. and what we have the frontal sinuses here. The frontal sinuses are located in the frontal bone. We have the maxillary sinuses located in the maxillary bone. The sphenoid sinuses are located in the sphenoid bone, and lastly ethmoid sinuses located in the ethmoid bone.